Hits 93.5.
Oh, yes, and we'll get to it in just a little bit. But as we promised, right now on the phone line, bringing you the COVID-19 Maui Health updates. We have on our phone line this morning CEO of Maui Health, Mr. Mike Rambis. Good morning, Mike.
Good morning.
You know, we were just talking off air for a few seconds on how information, well, we live in an information age, but crucial time right now. Wouldn't you say, Mike?
We've never seen anything like this, and hopefully we'll never see anything like this again.
Well, good thing we have you folks there at Maui Health collaborating with KPOA to bring the correct information, useful information to all of our listeners. Thank you for that, Mike.
That's why we're here.
Awesome. My first question, well, not mine. We have a lot of questions that was brought in from many of our listeners. And we want to thank actually all of our listeners for taking the time to bring in all of the questions. My first, well, not mine. I keep saying mine. It's not mine. There's a lot of social media discussion around PPE usage. Actually, a lot of social media discussion, period. Like you said, we've never seen before. Is it true that we have a shortage of PPE or personal protection equipment? Is that what it stands for?
There's a national shortage, especially if one was to look at what is needed for a surge, if there's a surge in cases. Right now at Maui Health, and all the residents, the entire community should know we have adequate PPE to take care of everyone in the hospital. Our concern is always a surge, and we've been told that we should look forward to seeing an increase in cases, as everyone is seeing in the nation, in the next couple of weeks. So we're trying to preserve PPE, so when that happens, we have adequate supply to protect not only our healthcare workers, our physicians, but the patients. So we have adequate PPE, but we're trying to follow CDC policies and be sure we don't waste any PPE.
True, which is very much needed with the COVID-19 patients. Are there any patients currently in the hospital?
I'm happy to say we have no positive patients. Every day we have a couple patients with respiratory problems and a fever, and we rule them out. We do the adequate testing and make sure that they don't have COVID-19. And so far, we have no positive patients in the hospital.
Awesome. Well, you know, we've been getting the updates of the new cases that come about, and it's this information we're getting from you that there are no patients currently with the virus in the hospital is actually very reassuring. So thank you for that, Mike. Also, you know,
it's probably inevitable at some point there will be a patient in the hospital.
That's true.
But our staff is trained. We have isolation rooms. We'll take care of the patients, and no one needs to have any fear or anxiety. Taking care of patients with infectious disease is something that we always do.
That's true. That's true. You know, speaking of anxiety, somebody maybe like myself who are not sure about, you know, where I'm standing as far as my health, should I get tested for the virus?
No, not unless you show symptoms. We just don't have enough test kits in the country, and that is the same for Maui. And everyone is recommending that you shouldn't be tested unless you're not feeling well and you have symptoms. And the best way to know if you have symptoms, if you're not feeling well, call your doctor, call your primary care physician, talk about your symptoms, and they'll tell you whether you need to be tested or not.
Awesome. I have a question from one of our Maui Now people who posted their question there. It's is the staff at the hospital allowed to wear masks? The ones not caring for the COVID patients, which we know there are no COVID patients right now, but are they allowed to wear masks? I don't know what's up with that question.
Well, right now, if someone is not working with a patient that's potentially a COVID-19, or if they don't have any symptoms of COVID-19, they have not been wearing masks. But as we've looked at the changes going on in the country, we're actually reevaluating that policy today. If our supply of PPE is adequate, it's very likely we're going to loosen that policy and let other healthcare workers wear a mask, not necessarily for their protection, but for their comfort. But we're going to re-examine that policy actually today. We've had a lot of feedback from the community and from our caregivers. And as long as we have adequate PPE supplies, and I think we do right now, we're going to probably loosen that policy up.
Awesome. Mike, I've been hearing a concern within my own family that if you get admitted to the hospital, let's say in the emergency room, that you're not allowed, like say for instance, if I was to take my son who's young, I'm not allowed to go with him. Is that true?
Unfortunately, we've changed our visitation policy. There is no one under 14 allowed in the hospital for visitors.
Okay.
And we've only allowed one visitor per patient in the emergency room at this time.
Awesome.
We are eliminating all visitors in the hospital. This is what every hospital is doing. It protects not only the visitors, but it protects our caregivers. You never know if someone is carrying the COVID-19, and we're just trying to reduce risk and exposure potentially for everyone in the community.
Well, you guys are doing a great job there, and that's some very, very important information, because I'm sure there's a lot of people by fears like, hey, I don't want to take you into the emergency room because then I might not even, I mean, that was a talk I've been hearing. So it's very good to hear that, hey, you won't be just taken away, and we'll have somebody to assist you or accompany you. Okay, well, hey, Mike.
And we continue to look at our visitor policy, and we'll make changes as the rest of the country makes recommendations. Awesome.
Okay, well, Mike, any other important facts or instruction you want to give us right now?
I think the most important thing is social distancing is important, and have comfort in knowing that your hospitals on Maui and Lanai are prepared to take care of you if you're sick. We are well prepared. Our staff is great. Our physicians are committed and dedicated, and we're here for you.
Awesome. Does Maui Health put out listed information like on your website, on some other things that they can get their hands on?
You sure can. Go to our website, and you'll see tons of information, not only about the hospital, but COVID-19.
Awesome. Mike Rembes, CEO of Maui Health, one of our first experts to call us here on the radio station. And Mike, we appreciate you calling us this morning and all of the hard work that you and your staff are doing there at Maui Health. Thank you very much.
You're welcome. Have a great day.
All right, Mike. KPOA 93.5 FM. You got to be listening every morning, 7:19. Tomorrow we'll be talking with Lisa Paulson from Maui Health. And I want to thank again Mike Rembes for giving us a call. Listen in all day, every day, 93.5 FM. Also tomorrow we'll be talking with the mayor in the 8 o'clock hour. Stay connected all day, every day, 93.5 and KPOA.com. Aloha Morning Show.